Seboric keratosis. Seboric keratosis are round, flat, waxy plaque that range from millimeter to several centimeter. The seboric keratosis are round, flat, coin-like waxy plaque, coin-like waxy plaque. The size of the seboric keratosis plaque range from millimeter to several centimeter. Range from millimeter to several centimeter. To several centimeter. Centimeter. These seboric keratosis plaques are uniformly tan to dark brown in color. They are tan to dark brown in color. Inspection with hand lens reveals small round pores with keratin. When we inspect with the lens, the inspection with the help of hand lens reveals a small pore-like plaque and filled with keratin. These are filled with keratin. On histologic examination, these neoplasms are exophytic and sharply demarcated. On histological examination, these seboric plaques are exophytic and sharply demarcated. These are exophytic and sharply demarcated. These are sharply demarcated plaques, and they are adjacent to the epidermis of the skin. They are adjacent to the epidermis of the skin. On the histological examination, we see sheets of small cells, sheets of cells. In these sheets of cells, we see the melanin pigmentation are present in these sheets of cells. The melanin pigmentation are present in these sheets of cells. A hyperkeratosis, that is, the melanin pigmentation occur at these sheets of cells, and this plaque is filled up with this plaque of the seboric keratosis is filled with keratin. Filled plaques are filled with keratin, and these keratin filled plaques are called Hahn cysts. These are called Hahn cysts. These Hahn cysts are the keratin filled plaques of the seboric keratosis. Sometimes the invagination of these keratin cysts also occur. Invagination of these keratin filled cysts also occur. And these cysts, when the invagination of these keratin filled cysts occur, this is called invagination cysts. Invagination cysts. Sometimes these keratin filled invagination occur in these cysts. That is called the invagination cysts. In which age the seboric keratosis occur? The seboric keratosis occur most frequently in older individuals. The seboric keratosis are present at which site of the skin? So they are present at the trunk, head and neck. They are present head and neck area. and the extremity. Sometimes at the extremities, these invagination cysts are keratin-filled cysts that called Hans cysts are present at the head region, neck region, and extremities. Most frequently occur in older individuals. What is the pathogenesis of the Seboric keratosis cysts? The pathogenesis is the mutation occur in the fibroblast growth factor receptor 3. Mutation occur in the fibroblasts growth factor receptor 3. Growth factor receptor 3, that is fibroblast growth factor receptor 3 mutation. Why the Seboric keratosis plaques occur? Because of the fibroblast growth factor receptor 3 mutation. Due to this mutation in the fibroblast growth factor receptor 3, the Seboric keratosis occurs. The Seboric keratosis also occur in the mutation in the tyrosine kinase. When mutation in the tyrosine kinase occur, it also causes the Seboric keratosis. The Seboric keratosis may be a part of the paraneoplastic syndrome. The Seboric keratosis may be a part of the paraneoplastic syndrome. In paraneoplastic syndrome, there is activation of the transforming growth factor alpha. And this transforming growth factor alpha is produced due to the gastrointestinal tumor. When the gastrointestinal tumors occur, it activates the fibroblast growth factor alpha. This fibroblast growth factor alpha causes the paraneoplastic syndrome. This paraneoplastic syndrome may cause the Seboric keratosis. And the Seboric keratosis also may be caused due to the mutation in the tyrosine kinase enzyme. And the Seboric keratosis also occur due to the fibroblast growth factor receptor 3 mutations.